It's now my pleasure to introduce Dr. Joan Bray. Joan received her first bachelor's degree from North Carolina State University in speech communications. She later went on to receive a degree in physical therapy from University of North Carolina in Chapel Hill. At that point, she really focused in geriatrics, orthopedics, and pain management. She then went on to get a doctorate in physical therapy, also from UNC, and that was focusing in orthopedics and geriatrics. She has a practice here in Southport, but outside her busy practice, she has many other interests, including outdoor activities, weight training, dance, theater, and live music venues. In 2023, Joan invested her retirement services to start a business to serve the community, and she focuses on reversing the diagnosis of osteopenia and osteoporosis, which I'm sure she will talk about here a little bit today. She also focuses on improving strength, joint stability, and balance. She approaches patient care through many facets and an emphasis on getting to the root of the problem in order to achieve the optimal outcomes. Please join me in welcoming Joan Bray to Nest. Thank you.
Okay, I'm on. Can you hear me? Everybody hear me? Do I need to readjust? Maybe a little higher? So a lot of times we think of falls and it's like, how do you fall or why did you fall? And you get anxious about it and when you're going to fall again, because once you fall, you've got a much higher percentage chance of falling again. A lot of this has to do with balance. Balance is, the definition of balance is an even distribution of weight, enabling someone or something to remain in an upright position. It can also be a condition in which different elements are equal or in the correct proportions. You people, I don't know if you've traveled, you've seen how people stack stones, and they're this large stack of stones, and you think, how in the world can that still be standing there? And that's balance, finding the right position. That's important with our bodies as well, and how they get out of balance. A fall is when someone is unintentionally ending up on the ground or a lower level. So it's not necessarily that you hit the ground. When the doctor asks you, have you had any falls? And you say, no, because you didn't hit the ground. But if you fell into your chair or you fell against the wall and it caught you, you still had a fall. And a lot of people don't report those things, but those are important to notice and to note to your doctor, because those are clues that things are getting ready to happen. Okay, you just were fortunate that you were caught by something or a wall. Falls can happen to people of all ages, but they are common and they are serious for older people. And a lot of that has to do with the fact because we become more frail as we get older. Our bodies are weaker. We recover a lot slower. And so that can create problems. You can, things that cause you to fall. I better turn on my computer here, huh? Yeah. Give you some statistics. Every second, an older adult falls. That's a lot. I mean, just as we're talking. And the time that we spend, you add up those minutes into seconds. That's how many people can fall.
That's just at St. James?
No. Thankfully, no, it's not just at St. James. But the biggest concern is not always about falling, it's but what happens when you fall and if you get an injury, and that requires a hospitalization. And what's interesting is that women tend to fall forward. So they're more likely to end up with a Colles fracture, wrist fracture. Men tend to fall backwards. So what do you think they hit the most? Their head, exactly. I have 3 falls in a period of 3 months. This was in the year 2020. I had one fall. I'm walking across the street with my sister, and we're just speeding right along, talking and not paying attention. But I have these cute little booties on, kind of a pointed toe, and we're walking across the street, and I stepped onto a manhole. And the manhole had this perfect little cutout for my shoe. And it was like I just put it in a puzzle, and it locked in. And I went forward because it was like somebody just reached up and grabbed my leg. And I kept going forward, and I landed on both my hands. Now, what saved me, I believe, is because my core was very strong. So it slowed my fall, as it slowed my descent. So as I was going down, I felt my body contract and my muscles prepare. And when I hit, I had a tiny bit of a sting on my hands, but not much. And I got back up and got my shoe out and went on my way. And I didn't have any kind of injuries. And I just thought, wow, that was freaky. Then a month later, I am walking in the neighborhood, and the neighborhood I lived in, this is in Durham, we had a lot of construction going on. It was a new neighborhood, and there was a piece of plastic circle, a band that had been holding some construction materials, and it was out in the street, and sidewalks weren't finished yet, so I'm walking in the street, and I see that, and I'm almost home, and I'm thinking of the next thing that I have to do, and I step over it, and when I stepped over it, I hit the edge, and I flipped that band up, and it lassoed my other leg. This time, and I had a hat on, this time I came down hard. But, again, saved by the core, when I came down, I literally came down in a push-up position, because when it lassoed my leg, I was straight, and I just went forward. Landing again on my hands, I hit harder. I also hit my chin, not my TMJ, temporomandibular joint, knocked that out of whack. Not my hat, it went flying. But that one, because when I hit my chin, I kind of rang my bells. That's what we used to say in sports. And I did not jump up after that one. I took a minute. And I got up and realized that that was a much more significant fall. I did not break anything. Now, I don't know if that was due to the fact that I was doing probably at least 150 to 200 push-ups every few days for my workout routine, and my wrists were strong. I didn't have any problems with my wrist. So I decided that I need to slow my roll a little bit and pay more attention when I was out. I'm listening to music, but to really be much more aware of my surroundings. And if I have an option to step over something or go around it. So I made a different decision. I made a choice to make a different decision should that opportunity present itself again. Then the third fall I had, anybody pickleballers in here? We've all heard about the pickleball falls. They're what keep our orthopedic surgeons in business nowadays. And so I was on the pickleball court. I hadn't been playing that long, and I did not have the correct shoes. When you play on a court, like a tennis court or a pickleball court, you are to wear a shoe that actually can slide. You don't want your shoe to really grip the court, and the ones that I had on were grippers. So when I went for a shot, I went, but the foot didn't. I was planted. This time I came down, landed on my right wrist and my right hip. And I was praising God when I got up that I didn't break anything. Because that had the possibility of being the worst possible chance of me getting a fracture. Now, I had at that time, I had osteopenic hips and osteoporotic spine. Didn't know what my wrist, but obviously I didn't even have soreness in my wrist the next day, which kind of surprised me. But that taught me, all of those falls really taught me how important the core was, but that when you have a fall, one of the predictors is, well, there's two factors in physics: velocity and force. How hard you hit and how fast you hit. And I remember in PT school them talking about tissue damage, that if you had when you watch some of the athletes, like especially football players, soccer players, somebody that gets hits and they get hit very hard and fast, a lot of times they've got something fractured. It's hard and fast, velocity and force is what fractures your bones. When you hit, now you're going to get some soft tissue damage, the muscles and the meniscus, the cartilage, but you can, and I had this unfortunate instance. I had a Cocker Spaniel, and we were redoing our house, and a truck was out in the driveway. My husband decided to move the truck and didn't see the dog. He backed up over the dog. The dog did not have one broken bone, but it damaged the tissue. So it's low and slow that damages the muscles, the tendons, but I was amazed that she had no broken bones. Now she had started having kidney issues after that because everything had been kind of squashed. But that's kind of the nature of falls. And so the thing that's important is when you fall is being able to get back up. The survival rate, if you have a fracture, and a lot of it depends on age, usually after the age of 80, the prediction is if you have a hip fracture, that you have an 80% chance of death within a year. That's not very good. 80% death. After 80, yes. So your chances of not making it back. Now, there's a lot of reasons for that, and it's because of what's the condition you're in when you have a fall. I mean, that's really what it's going to be about, is what kind of shape were you in before you had a fall. And, of course, those are predictors of how you're going to do with having falls. Yes? After 80, that you have an 80% chance. If you have a fall and you fracture your hip, you have an 80% chance of death within a year. Within a year. He's not. Because once that fracture happens, that person is going to be a lot less active. And how long do you think it takes those muscles to atrophy? I remember in school, they told us 2 weeks. But that was a healthy athlete. Actually, they were talking about a world-class athlete. I found after I had a bicycle accident, tore my right rotator cuff at the age of 60, that I had this nice muscle here. Okay? And 3 days after I had surgery on this arm, and I had to keep it immobilized, I took the immobilizer off, against the doctor's orders, and noticed that all I had was hanging skin. I had no muscle. 3 days. I had worked out 3 days before I had surgery. And my muscle was intact. I had no problems. But just immobilizing it for 3 days, that muscle just disappeared. And that took me, I'd say, 9 months to get it all back. And that was hard work. So there are a lot of things that put people at risk for falls. Your illness is one. Depression can put you at risk for falls. You're focusing on the past. That's what depression is. Now, you may have a chemical imbalance, and that's a different thing. And, of course, there's medications that can influence that. Any neurological disorder, Parkinson's, multiple sclerosis, ALS, those are just the 3 big ones. Having a neuropathy. Anybody in here have neuropathy in their feet? Yeah, when you have a neuropathy, you can't tell where your feet are in space. And sometimes you may have also lost the function of the ability to bring your toes up to dorsiflex. And when you lose that ability, you tend to trip over things. You've got to really watch. Oops. what kind of things in your house relating to rugs, thresholds, and things along that line. Hospitalization. When you're in the hospital, if you get therapy, it's very minimal, and you're not getting up and moving around a lot, and it's important that you move as much as you can. Any surgical procedure, you have a surgical procedure, and if it's on an ankle or a knee or a hip, all that kind of knocks those things out. And that's why they try to get you up as soon as possible after that surgery to prevent clots, to keep everything in your system working. Motion is lotion. I said that. Motion is lotion. So it's important to be moving. We are not created to sit. We're created to move. And I don't know if anybody's ever seen anybody that sits in a chair all day, and when they get up, I call that the evolution of man. They sit in a chair, and they're in there, and they got that recliner, and their legs are brought up, and then what happens when you go to get up? You're like this, and then it takes a little bit to get up to that position, because all your muscles have shortened. They've been sitting too long. And you can change that by just even change, if you do things in your chair to extend you and to get your hips forward, to lift yourself up, but come into a position where you are not in that kind of a seat, because now your hip flexors get tight, our head's tight because we're forward looking at our technology, and then your hamstrings are tight. Your calves get tight, and then it makes it much more difficult for you to walk, which then increases your risk for falling. You might have just weakness. You've laid off for any of those above reasons, and you have not done your workout, your exercise, your regular routine, and you get weak. We get weak very quickly. We do not have the luxury when we were in our 20s that you drop doing something and you could get back to it in a week or two. You know, the older we get, the longer. If I lay off my workout, it could take me 6 months to get it back instead of a couple of weeks. If we have any incontinence of bowel and bladder, so that makes you want to rush. You're trying to get to the bathroom. You don't want to have an accident. But there's things that you can actually do for, especially when you have urgency. I used to do pelvic floor work, pelvic health, and there's a real simple thing you can do to buy you some time. One, and if you don't know what Kegels are, but I'll tell you, Kegels, just doing a few Kegels stimulates your bladder and tells it to relax. But if you're not sure about that, you haven't done those, you haven't learned those, you can always, whether you're lying down, sitting, if you are standing, you can hold on to something and come up and down on your toes about 10, 15 times. You can do it in a chair. You can sit, toes, heels up and down. If you're lying in the bed, say first thing in the morning, and you know you're going to have to go to the bathroom, and you know that as soon as you sit up, nature's going to really hit you hard. So what you can do is lay in your bed, point and flex your ankles. Work those. There is a nerve it's called the tibial nerve, right behind the tibia, and somehow it is connected to your detrusor muscle, which is your bladder, and it actually causes it to relax. So when you get that sense of urgency, what's happening with that is your bladder, it's about the size of your fist, not your fist, my fist, yours is your fist. And when you get the bladder gets 50% full, it will give you a signal, gotta go to the bathroom. And now most of us think, oh, I've got to go to the bathroom. Well, as we get older, what happens, we're home all the time. We go to the bathroom more frequently. Well, what's happening is you're actually going to decrease the size of your bladder because you're going to the bathroom, and now that bladder is going to shrink, and when it gets half full, it's going to be a lot sooner. So what you can actually do is practice, try to extend your time before you go to the bathroom to get your bladder really full. If you can relax it for a while, let it fill up a little more. It's like our kidneys are just dropping urine in there, a little drop at a time, and it'll continue to fill. But you can teach yourself, retrain your bladder so you don't have as much of a sense of urgency. When I first learned the pelvic floor, that's what drove me to going to courses, because I was at the age of 60, I was getting up twice a night to go to the bathroom. I didn't like that. So I'm 70 now. I don't get up at all to go to the bathroom. And I don't have to run to go to the bathroom in the morning. But I learned how to do my Kegels and my exercises, and I usually do a few stretches before I even get out of bed. So it can be changed. We're clay. We're malleable. But what happens when we get that urgency, either bowel or bladder, is then we start to rush. And that was my problem when I was doing my walking. Rushing, trying to think of different things, thinking of all the stuff we've got to do next, not staying in the moment. One of my goals this year is to stay in the moment and enjoy this moment that I'm in, because I'm not promised anything beyond this time. If you have vertigo or vestibular issues, anybody in here have BPPV? Know what that is? Benign peripheral proximal vertigo. It's when you have little crystals in your ears, and there is a maneuver that you can do that can change that. But it can be very frightening when you feel like the whole world is rolling around. But if you have those issues, that's something you have to be aware of that puts you in a higher risk for falls. Visual impairment. Now, we might think, oh, well, if you're losing your vision, you have cataracts. But what happens when you just wear bifocals? That changes the focus of how things look on the floor. When first time I started wearing glasses, I was like, whoa, I'm looking down going, everything looks very strange because it changes the proportion of how things normally look. And unless you have some type of a transition, I wear monovision contacts now. So it changes your perception. And so you have to be very careful of where you put your feet. A big one is postural deviations. Let me see if I can find this one. This guy here. Posture is often seen with aging. So good posture, you can see he's got this kind of nice line between from his ears down to the shoulder, hips, knees, and ankles. But we start with the forward head, and nowadays you're seeing a lot of young people, they call it tech neck, because everybody's like this. And so everybody's head's down here. And anytime I'd have a patient that I'd be working with on neck issues, the first thing I check is when they're out waiting to see if they're on their phone like this, or if they're bringing it up. Because I tell everybody about bring your book up, bring your phone up. You don't want to have anything hanging down. Anybody know what a head weighs? Any idea? 10 can be 10 to 15 pounds. That's if it's centered correctly. Okay? So as soon as that head starts going forward, now you notice as we start here with the forward head, and then this fella, he's starting to get more what we call kyphotic. So he is starting to tighten in the chest, and his thoracic area is getting rounded. So now the head goes out even further. The back is flat. If I can put a cushion in my low back, sometimes getting a curve there helps change the thoracic, and it changes my neck position. They all impact each other. It's not just one or the other, it's all of them working together. You see this other fellow here, he's got a lumbar lordosis, which puts him forward. That's more common in women than it is in men. Men is more sway back. Okay? But if you look at those postures, and we all tend to, everything we do is forward. We don't do a lot of stuff back here. So we have to purposefully do things to help correct our posture. We need to strengthen the muscles in the back so they can hold us up. But if you're here and your neck hurts, it's not your neck. It's really your thoracic. And the same thing with the low back. If you've got a back problem, you've got a neck problem. So it's important to incorporate movements that help to open up places that get tight from sitting or being forward. We've got to do some things to reverse that. Here's another slide, and this, of course, talks from infancy, how we get up, how, babies fall all the time. But, the bones are kind of rubber at that time when, they fall down all the time. And then as we age, we start, and you see this fellow, that's the next to last, that has a walking stick or a cane, and he's so bent forward. And again, a lot of that comes from inactivity. And then at the end stage is fetal position. Sitting posture, this talks about correct sitting posture. And the only thing I will really disagree about this, especially if you have a back issue, this fellow that is sitting in the chair, they've got him in a perfectly 90 degrees. I actually prefer to be more in 100 degrees. So if I'm in a chair for a long period of time, I want my legs lower than my chair, because that helps me to keep this open more. So you can either elevate your chair, but that's what kind of recliners do, is they're opening you, okay? But again, it's still about staying in one position for a long period of time. And this fellow here at the computer, now the vision, notice this, the top line. If you have to sit at a computer for a long period of time, you want the eyes to be straight at the top of your computer. They should line up with the top of your screen. So you can look down, but you do not want your computer up here, and you do not want it down here, because then you're going to bring your head forward. When I was working on my doctorate, I found that out with my laptop, and I had to get a keyboard, a Bluetooth keyboard to put in my lap so that I could elevate my laptop to be at the correct height, because within 2 weeks of working on a computer, I started getting neck pain because I didn't have the computer in the correct position. So ergonomics is important. Sitting posture, if you have someone in a wheelchair, it's important to keep them centered using cushions. And, heaven, if you are really tall, they don't make a lot of great wheelchairs for you, unfortunately. They're all too small. So how heavy is your head? That 10, 12 pounds can become 42 pounds when you let that head hang out there and that thoracic gets bowed. So now your neck muscles are complaining because they've got to hold up 42 pounds. That's why your neck hurts. Your body's talking to you. Assistive devices. This used to be one of my favorites. I called it the Cadillac, the rollator. Anybody have anybody with a rollator? They're great. They're easy to maneuver. I said, well, if you only need a little fingertip control for balance, they might be great. But most of them are low. And even when you pull the handles all the way up, most of the time, I've seen guys that were 6'2", and they go to a hospital or a rehab, and they come home with this walker that's down here, and the handles are up about right here, but they're still too short. So the problem with them also is they have 4 wheels, 2 locked, but the 2 front swivel wheels, they still move, even if the back wheels are locked. And so that can be a safety issue. They can get away from you. It's nice it has a little seat, but people will sit and propel themselves, and that's not a good idea either, because that's not safe. These are some other 2-wheel walkers. These are 2 fixed wheels. The back have more gliders. We've got, these are forearm crutches. Those are nice if you've got pretty decent balance. They're actually much easier to use because they are reciprocal. They work with how your body works. Again, I've seen a lot of people with a three-wheeler, and it's not that stable either because it's that triangle. It's not as stable as the square. Here are some different devices. Michael Graves, they have curves so you can use the lower part to push to get up instead of being up here trying to push to get up. It gives you a handle to kind of push. Another chair that is designed to help people get up out of the chair. And you notice he is sitting back in the chair. He moves to the front of the chair and pushes up from there. It's very difficult to stand up from the very back of the chair. So it's important when you have someone that's got to get up and you can stand by, get them to scoot to the edge or wiggle their bottom if they can. They can hold on to the chair, getting their head looking up, not down, but trying to get their head past their knees. As soon as you get past your knees, these muscles start to contract. So that's an assist for you. But your head, again, if it's out there, that's weight, and you are getting that counterbalance, that helps you to get the weight off your bum. It's very hard to sit in the back and stand up. It's just mechanically not doable. And so people will struggle, then they fall back in the chair because as soon as they get partway up, their head goes back and that weight just throws them right back in the chair. So you have to keep that head forward to help them get out of the chair. Some of them have slow down breakers. Walking sticks are great if you don't need a lot of heavy, if you've got an injury and you've got to get weight off of a leg, you're going to have more of the standard walker. Another one that I like is this U-step. This, it is more upright. It's got a larger base for you to step in. But the ones that I really like, I didn't find a picture of, they actually have armrest. And I love those because I've been a manual therapist for many years, and your thumbs start to wear out after a while. And when you have to push your hands on a walker to bear weight on it, it's very bothersome with your hands. And then if you're hurting in your hands, it's going to be harder for you to walk appropriately because you're focusing on what you're feeling in your hands. It should be comfortable. If somebody, and I've had this happen, a patient come in on outpatient and they went to the hospital, or I'd see them at home when I did home health, and they come in and their walker is up to here. And I'm like, wow, let's check out that walker. Oh, well, the therapist already adjusted it for me. I said, okay, well, I'm going to show you why we don't want that walker up that high. And I have seen many people, and many of them are frailer women, and they've got this walker and they need to put weight on it, and their walker's up here. So now, what's happening with their shoulders? They're tearing up the rotator cuffs. And that's usually what happens, is they end up with shoulder problems because the walker's too high. So the walker needs to be where you can actually hold it here, or either, again, rest your forearms in a walker that has the armrest. Another big risk for falls. I did want to put this one up. This is a falls-free checkup screener. Now, I don't know if you can see that. It's a long name, but at nca.org/age-well-planner/assessment/falls-free-checkup. But you can go to that and it'll give you some things that you can look at to see, how can you assess for falls. And it gives you a little video and tells you what to do next. That's just another continuation. Plato says a lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. We've all heard the use it or lose it. You know, if you want to keep your teeth, what do? You brush them. You floss them. You do whatever you get your regular checkups. Make sure that things are working like they should. Your muscles, I tell people, let's exercise the one you want to keep. You decide. You got about 280 some muscles. Got eye muscles. Got jaw, tongue muscles. But exercise is important because what it does to you neurologically, I am one workout away from a good mood. I may not feel like working out. It may not be my best day, but when I finish working out, I am so happy that I did that. It's done. I don't have to think about it the rest of the day. I don't have to punish myself in my mind that I didn't work out today. But I feel better, and it releases endorphins into your system. It improves your immune system. It's a great thing for you. It doesn't have to be horrifically hard. Okay, let's see. So now a few of the things on how to prevent falls. One is pay attention to your surroundings. If you're walking outside on sidewalks, they are not always nice and straight. You may have a little bit of a bump. What kind of rugs do you have in your house when you're walking around? You've got rugs with fringe on them. You have rugs that are elevated, or, I know a lot of us, when we like those rattan, or what do they call the rugs, they're woven, but they're thick, the natural fiber. They look so nice, but they are so dangerous because they're real easy to catch your toe on, and they're just not a good thing for you to have in your house if you want to be safe and prevent falls. The traction on your shoes. Now, one of the things that I have switched to lately is barefoot shoes. Barefoot shoes, these are little booties, hiking boots, and they have a thinner, I see a lot more people wearing these hugely thick shoes. And when you wear a shoe that thick, you are really not making good contact with the ground. It's almost like giving yourself a neuropathy. Now, I know we want cushion, we want to feel a little comfortable, but it's getting kind of extreme now when I see people, and I'm seeing some really big shoes, and I think I could trip over that just wearing that shoe. So you want to pay attention to your shoes. You want your toes to be able to spread out because those toes are giving you feedback of where you are, and you want them to be working effectively. So you want to pay attention to the type of shoes that you wear. Oh, ladders. How about ladders? Anybody in here still get up on ladders? So, it's like with any piece of equipment that we use. If you're going to use a ladder, you shouldn't be by yourself. Because if you fall somewhere and you don't have anybody at home, who knows when they're going to find you? Because you've got to think ahead. You also want to make sure, if you're using a step ladder, that it is even, that it is locked, that you have something else close by, that you line it up exactly with where you need to be so that you're not having to reach over that direction. And again, remember the balance, the definition of balance, throwing your balance off by reaching. You're getting out of that nice plane. So if you've got to use one, even when you have somebody with you, you want some assistance. Somebody can give you a hand on your calf to stabilize you, holding the ladder at the same time. Even though the ladder may be locked in position, you want to make sure that person doesn't feel wobbly and start wobbling the ladder. That can happen. All right, so now this is a picture of a mat, non-skid mat for like a bathroom floor. If you've got a rug in your bathroom and it slides around on that tile floor, that's not safe at all. You can use non-skid mats in the shower, different kind, they're not cloth. Your grab bars. Now, a lot of the homes nowadays, when you have them made, they will put grab bars in. But I had to remind, and a lot of people don't know this, but if you talk to an OT or a PT, they're going to tell you, do not put your grab bar in a horizontal plane. Because if you are in the bathroom and you're on the commode and you are sitting down and you think, oh, that's a perfect place for it. But then you pull yourself up and now you're up here and you're leaning forward to hold on to it. So it's not a perfect place. So you actually want your grab bars to go diagonally. You want to start at a low position where you're seated to a higher position. When I had my house built in Durham, I explained this to the builder or the contractor, and he was in agreement with that. But I went in and they put the bar in the opposite direction. So that's what happens when you're building a house. You have to stay on top of it. So I had to come in and I saw that. I called him up and I said, the grab bar looks great except for one small problem. It's going the wrong direction. So you're going to have to come and take out that tile and redo that grab bar. And he did. No problem. All right, next is thinking of medications. Medications or supplements. Vitamin D, they did a landmark study. Gosh, this was back in I believe it was in the late 90s, early 2000s. They came out, New England Journal of Medicine came out with a research project where they took people who lived in a nursing home who had Alzheimer's. Now, I don't know if you've ever worked or been around people with Alzheimer's. They walk a lot. They walk until they fall down because they're exhausted. And so people were falling so much. Well, they did a test, blood work, and they found that all of them were deficient in vitamin D. So what they did is they took half of them and gave them vitamin D and brought their levels up. I think they probably gave them injections and to make it a little quicker. Brought all their D levels up. They reduced their falls by 50%. And the people who did not get that vitamin D, nothing changed. They continued to fall very frequently. Vitamin D has been found to be so important. If you're taking calcium, you think, I'm going to help my bones. If you're not taking the right amount of D, and D3, it's D2, D3, your calcium is not going to be used as you think it is. And they go to plaque, go to your kidneys and give you some kidney stones. Sleep aids. Anybody have problems sleeping in here? Getting to sleep? Staying asleep? So if you use a sleep aid, those can be a really serious reason or risk, put you at risk for falls because they are changing you neurologically. They make your senses dull. They're going to change your response time. And so if you wake up in the middle of the night, and I will tell you, if I had to get up in the middle of the night because I had tried everything and I still could not seem to get my bladder under control, I would be putting a bedside commode near my bed. And that's just so that you don't have to get up and walk a long distance, especially if you have to take some kind of sleep aid. You would need to have it positioned correctly, not right directly in front, but at a side position so that you basically stand up, turn around, down. A lot of times people want to get up and they think if it's here, and then they have to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rather than 3 steps instead of 10. That just lessens your risk for falls. You can also look, the American Geriatric Society in 2019 updated the Beers criteria for medication list of potentially inappropriate use of medications for older populations. There are some medications we shouldn't take. And so that's an important thing to discuss with your doctor. If you're taking things that There are many medications that will make you dizzy, that will make you nauseous, and of course, if you have to take Lasix, we all know what that does. You're going to be running to the bathroom all the time. So it's important to discuss those things with your doctor and how you can time them. If you have any concerns and any kind of problems that you feel like you're creating, it's important to discuss these with your doctor to get them changed. All right, so predictors of falls. One of the things that I like to do, let's see here. Here's my barefoot shoes. There's my Ambien. This is one of the medications that is a big one that's used. And I don't know if you can read all of that, the adverse effects. Depersonalization, abnormal dreams, lethargy, memory loss, delirium. Who doesn't want that? Slow reflexes, depression, emotional liability, addiction, confusion. Concentration, I can't understand. Concentration difficulties, suicidal tendencies, amnesia, insomnia. There's a lot of things relating to memory in that one if it's taken on a regular basis. It can be it really does a number on the brain. And you add alcohol to that, lots of fun. Let's see. All right. Let's get back. So what I want to show you is a single leg stance. So one of the quick little balance tests that I do is a single leg stance. And that's being able to shift your weight to one side and stand on one leg and lift it up. You have your hands across your chest. And just think, can you stand there for 30 seconds? Now you can practice this in front of your sink, brushing your teeth, but be near something so that you've got something to hold on to should you need it. But the biggest predictor of predicting falls is hands across your chest, leg up, close your eyes, and hold that for 5 seconds. That's a tough one. That's a real tough one. But you can practice those things in front of a counter because your feet, and I would do them barefoot, it is your feet that is giving you information neurologically to your brain as far as where you are in space. You should feel your toes kind of grabbing. Now, if you have a neuropathy, that may be different, but you can still practice. It's training the body. You're training for things that could happen so that you can be prepared. Another test that is used that can give you an idea because it shows 2 turns, a sit to stand and a stand to sit, is called the timed up and go or tug. You're sitting in a chair without using your hands. You stand up, you walk 10 meters, and then you come back and sit down. And it's a time sport. You should be able to do under 12 seconds to be in a low fall risk. And then the Romberg test is another, which all you do is put the feet together and try to stand and see how you do that. That's a good one to start with. So how do we reduce falls and how do we fall properly? We talked about home assessment. You can have a therapist come in, but now I don't know if you're at the Nest. If you do you have a PT that could come in and do your assessments? Okay. But, I mean, I didn't know if the Nest had somebody that they could get to come in. So I know that there's some PTs that have lived in there because I've known some of the home health therapists and stuff. So, you know, if you can get someone that would be willing to come in and do a home assessment, it's just a quick check the rugs, check what kind of flooring you have. What do you need? Grab bars? Do you need an elevated commode seat? Do you need a bedside commode? Do you need a shower chair? Things of that nature. Of course, like I said, your footwear, make sure you got non-skid bottoms. More appropriate assistive devices. You want to improve your strength, improve your posture, practice your balance, reduce your medication interaction, and I know y'all are going to love this one, reduce your alcohol intake. Gosh, I'm retired. I'm going to have a good time. Well, you're just working on that brain again. It creates neurological impairment, and it can impair you to the point where you can have a fall. And it won't be always when you're drinking. It's later that you get the damage. And make sure your vitamin D levels are up. Get a good night's sleep if you can. There's a lot of things that you can do nowadays depending on what your issue is. Are you waking up because you have to go to the bathroom? Then you need to see a pelvic floor therapist. Men and women. You men have the same pelvic floor muscles we do, except you lost one. We've got one more than you do. But your equipment's different, so you got another advantage than we don't have. So, are you waking up because of sound? Are you waking up because you've got too many LED lights in your room and you don't realize how those things impact your sleep? They can wake you up. I never keep my phone in my bedroom. It's always in the kitchen. Never keep my phone in the bedroom because of the vibration things and all the cellular stuff that goes on. They're finding way too much. I've even changed using my Bluetooth earbuds because they're starting to see a very sharp rise in brain cancer. And they're starting to see some correlations, especially in younger people, which that's really scary. All right, so how do you fall? I know that was one of the questions. I want to make sure I address that. And if you fall, and your person, whoever has fallen, and if you do not have a device that can alert, the alerts that can automatically call someone for EMS. Some of them are amazing. I had a patient, home health patient once, and she had one that if she flopped down on her sofa, she would get a phone call. And she was doing really well. She had a 4-wheel walker, and she still lived at home by herself. She gave me a call, though, one day because she had a fall. And she described it to me. She had decided to go out into her backyard, which hadn't been mowed in probably a couple of months. And she had pine cones all in it. And, of course, she didn't take her walker. She used a cane. And she gets out there and steps on a pine cone, and it throws her back. And she has this great big giant flower pot. And she literally fell back into the flower pot with her arms and legs hanging out. She couldn't get out of the flower pot. But her wristwatch that she had called the EMS, and they're banging on her door, and she's like, I'm out in the backyard, in the pot. So I said, I wish you had taken a picture of that. I would have loved to have a picture of that one. But they got her out, but again, you don't know how it can happen. It can be things unseen, things that are seen. When we fall younger, I was saying when we have babies, they fall all the time. But they also tend to just plump. They are not fearful of falling. And fear is one of the biggest risks of falls. If I have a patient and they are terrified that they are going to fall, I tell it's like arguing for your limitations. They're yours. I can't take that away from you. We've got to work slowly and practice and build confidence. But one of the things that builds your confidence is improving your strength. And when you improve your strength, your body knows it can take care of things. It knows automatically. Yeah, so. Let's call this. Okay, so I'm going to show you how if you have a fall and you're down on the floor. Now, maybe I should just back up. If you can anticipate you're going to fall, you want to crumble. What you're trying to do is have as much area on the floor as possible. It's when you get these fine, straight lines that you have a greater chance of fracturing something. When that hits first and you land hard. But if you could practice, and I'll tell you how to do that, but you want to protect your head. You don't really want to fall forward, and you don't really want to fall backward. If you got a preference, it's to fall down, more crumpling down on your side. Again, it's a lowering down more than a falling down, even though it counts as a fall. Now, where you can practice this, unless you have what I call those princess beds that are really high. If your bed, and I've lowered many beds when I've gone into homes for safety, the beds are way too high. If you can't sit down on the bed with your hips and knees fairly bent, then it's probably too high. It might be easy to get out of, but if you need a step ladder to get into it, it's too high. You need to have a good height to get out of, but you got to be able to get into it as well. But you can actually get next to your bed and face your bed and then just turn a foot and fall into your bed. Practice one side, practice the other. Which I what I want to go to. So it's practice because what you're doing is actually teaching your brain something. It's neuroplasticity. We are doing something to change the way the brain thinks and responds to situations. Now, you can join karate, you can do that, but because they teach you how to fall. I took karate in my 40s with my son, and we had to fall and hit. Both arms had to be slapped down against the floor when we fell. It's, again, to put more area because of force and velocity. The more area you have, it reduces the force of the fall. So it's not all pointed to just one direction. But if you get down on the floor and you are capable, you have enough strength to move. But if you have an accident and you're falling on the floor, hopefully we all have knees, even though they might be a little more worn. I know mine are. So if I'm down on the floor and I've fallen and I've just kind of crumpled down and I'm like, oh boy, that was fun. I'm going to lay on my back, maybe with my knees bent. I want to feel what's going on before I try to do anything. I want to know, do I have anything bleeding? Did I hit my head? Do I feel anything? Can I lift my hips? Can I roll my leg first? Roll my other leg. This is checking out the hip, by the way. I can do a bridge. Might do the bridge. Might be pretty good. Same thing with arms. Can I move my arms? How do things feel? Try to just get a sense of what's going on in your body. Then I'm going to roll to the side. You pick whichever side you want. Then you're going to roll to your knees and your hands, just like when you were a baby. And you're going to try to get to the next closest thing, whether it's a bed or a chair that's stable. Don't get in, your rocking chairs might not be too great. They might just throw you right back on the floor. But if you can get one arm up, pick your strongest leg. You might not know, but pick one leg. And then you're going to lean into the chair to help you because your legs are probably going to be a little shaky. But you can push on the chair, then try and walk your legs up. Now, if you got super tight hamstrings, guys, it's going to be harder for you. Flexibility is a huge issue when we get older. It's probably just as important as the strengthening because we start tightening up and we need to keep things loose. Like I said, motion is lotion. So that's how you would get up off the floor. Now, if you know something doesn't feel right, don't get up. I mean, when I fell, when my bicycle hit a hole and I went down on my side and I hit my elbow, I knew how it felt. I had injured my shoulder. My husband came over and started to help me out and say, don't touch. Let me just lay here a minute so I can see what's going on. You know, and I was able to get up. I could still move. I even actually finished my bike ride, went home and put some ice on it. Take the time. But if you fall down, you know that you got something injured, you call EMS. Now, even if you don't have something injured, if you are 6'4" and your wife is 5 foot, don't expect her to get you up off the floor. That's just unrealistic. We don't need to get her down on the floor and then go both waller around a little bit. So be realistic, because this is something they do all the time. Okay, it's not something you're not accustomed to, and you want to protect yourself, because if you are injured, you try to get up and you fall down again, you're just going to make matters worse. But do want to make sure, if you can, if you are fully conscious, make sure that person gets some water if they need it. You get dehydrated. Sometimes that can help you to kind of calm down. But, you know, if the person's really groggy and saying crazy things that's not usual, then you don't want to offer somebody something that they're going to choke on, or that they're going to have a hard time with. So again, this is another diagram if you fall down using a chair. They do have devices. This is another, again, diagram. Crawling on your hands and knees, get to a chair or a bed. Anything that's solid that you can get yourself up on. And when you get up, sit down and wait a few minutes. Don't try to just pop up and go off again, because you don't really want to fall again. And the key thing is protecting your head. I had 2 weeks before Christmas, one of my favorite uncles was 94. He'd been out mowing his yard probably a month earlier, and he was doing something, had a fall, hit his head, got a brain bleed. He was gone in a month. Changed his whole neurological program. And he was somebody who was always cutting up jokes. And it was just, you know, it was that quick. So when you hit your head, we've got to really protect that head and not avoid doing that. This is talking about backward chaining. This is getting on the floor, practicing getting on the floor safely. You can reverse engineer this to practice by, you know, you're sitting in a chair, you get up, you come here, you put one leg down, the other, and get down to your hands and knees. What will happen is you do that, as soon as you get started, you're going to know when you need some stretching and where you need it. So there's your cue right there to get someone to help you to improve your flexibility. All right, so I did that. So now, if somebody want to know what are they, I'm going to combine this muscle, what muscle group can we strengthen to protect us or to prevent having falls, and then what exercises to strengthen the core. I don't do a lot of core work, but I have a strong core. But the exercises that I do, I use a plate, a bar, and a very thick band. It's called the X3 system. I do 4 exercises in the morning. It takes me about 15 minutes to do my workout. When I do it, it's hard. And if it gets easy, I make it harder. Because when I use that, because I'm standing on that plate and I'm holding and I'm pulling that up, I have to engage my core functionally to do those exercises. So it works many muscle groups at one time. That's what I use in my business for when I'm training women trying to reverse the osteoporosis and osteopenia. And that's what we use. The other exercise that I get a lot of every day is I'm a former cheerleader. And old cheerleaders never die. We just find somebody else to cheer for. So I am cheering my folks when they're doing their compressions for their bones. And I'm like, push, 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 push. And at the end of the day, I mean, I can really tell I have worked my core. So that's pretty much taking care of that. But easy things that you can do. I'm going to ask you all to do this. So now you're all sitting in your chair, put your stuff down. This is a great one because it works your lower core. Your lower core is also your deep core, are your hip flexors. They go deep inside, behind the abdominal wall. They're actually on the back side, on the front of your spine, on each side. The psoas muscle, they're hip flexors. If you're standing, they're hip flexors. If you bend forward, they're trunk flexors. But they connect from the inner part of the thigh into the deep abdomen. And this is a great exercise to work those, but it also, your pelvic floor is a basket. It is the base of your core. So if your pelvic floor is weak, your core is weak. So that's why that's important. So what you're going to do is I want everybody to hold their arms up. Way high as you can get them. And now what you're going to do is you're going to raise the knee up and then put it back down. And then raise another knee up and put it back down. Keep going. So while you're watching TV or listening to the news or waiting for somebody to fix dinner or pick up dinner, you can sit there for 5 minutes and work your core. Anybody feel that? You're also working, you know you're working your arms, your shoulders. Shoulders are very important. You've got to be able to reach to get into cabinets. But that's a very simple exercise. You can sit in the chair, you can do alternating elbow to knee. That's another easy one. You can do that sitting. If you've got the ability, you can certainly do it standing. You know, if you can't get your knee up that high, I didn't start high. I got high because I practiced. My muscles got stronger. If you're sitting in bed watching TV because you were up in your bedroom, you can put your legs out straight and lift one up and take it over. Up and over. Now again, it's going to work that hip flexor, it's going to work your core. Your core has to work to do that. You're going to feel it. If you feel it in your back, then you need to tuck harder because you're overextending your back if you're when you're doing that particular movement. Then the other one, which is my favorite, which I call, I'm going to use this because this is firmer. I call them sink squats. Everybody's got a sink, right? You got a bathroom sink, you got a kitchen sink. I love the kitchen sink. You can do all kinds of great things at the kitchen sink. But if you grab hold of that kitchen sink, you stand back, arms are straight. I'm going to hold here. I'm going to squat down and come back up. So I am working my quadriceps, my hamstrings, my glutes, my core. Shoulders really shouldn't be doing a lot. They're just kind of holding on for balance. But you want to get your hips back. You don't want to squat with your knees going forward because that will really wreck your knees. So you want butt back and down so that your knees are just over your ankle. Go down as low as you can. If you feel like, ooh, that's a little uncomfortable, that's where you stop. But every time you do it, try to work into that a little bit. Because if you keep working something, motion is lotion. That will get those joints working better. If you stop doing it and just avoid doing it, the joints will get stiffer, I promise you. Yes? Repeat what I just did. It's sink squats. So you grab hold of your counter or your sink. I like the sink because you can put your hands inside of it. You're going to bring your butt way back and bring it down. And then come back up. Now, if you want to work on improving your knees, now this depends. If you've got bone on bone, this is not going to help you. You're not going to be able to do that. But if you still got some cartilage left, I got 75% left in this one. I got 50% left in this one. But I can come down and get lower. Now I feel stiffness here, so it makes me want to get down and bounce a little bit. And that's what I do to keep my knees working. I go into the discomfort a little bit. So that can get those muscles stretched out, get them working in that position, and they get better. They do get better. So do your hips. Hips and knees. Hips and knees. Those hips get very tight. Let's see. And we talked about, somebody mentioned hydration. Hydration is always important, but it's important for you to know that drinking gallons and gallons of water, if it's purified water, you're rinsing out all your electrolytes. So you really need to make sure you're getting electrolytes, whether you get some good Redmond salt or a Celtic salt, put a little pinch of that in your water to get the minerals, the electrolytes that you need. Because if you drink a lot of purified water, it's got nothing in it. So it just rinses out what you have. So you might be getting a lot of water, but you may have some issues with still cramps. Anybody get cramps at night? I take magnesium glycinate before I go to bed, and that seems to help with everything. But boy, they can wake you up. All right, I think I covered all of those. Anybody else have any questions? Yes, sir. Getting up off the floor when there's nothing to grab onto. You have to get to where there's something to grab onto. Because I'll show you how to do it, but most people, if they don't have the strength or the flexibility, that's where the problem arises. So if you fall and you're down on the ground and you go to get up, you roll on your side, you get on your hands and knees. And if you have no place to go to get anything, you got to pick a leg. Pick the leg that's the strongest. That one needs to go first. So that leg is going to go up. You are going to have to use your body. And you would have to put pressure on that leg that you have forward so that you can push on that leg and push back with the other leg. But that takes a lot of strength. So if you don't have the strength and you've fallen, and the thing that's interesting is when we have a fall, it does a number on your brain. You're shaken. You're not sure what's going to happen next. You don't know if you're injured. If you make sure you don't have anything at all that hurts, because usually if you have a fracture, you know something right away. It's painful. But because you've got to have the strength to be able to get up and down. And that's where the exercises come in. And doing squats, doing those chair exercises, you can do things like that every day. And, that's going to help strengthen you. But you've got to do something. You cannot just be still. I used to joke with my home health patients. You know what happens when you sit in your chair too long and nobody moves? They start throwing dirt over you. Well, thank you. You've been great. I've enjoyed it.